All right, well, a new medical study suggests that long COVID could be behind the mysterious rise in pediatric hepatitis cases. The World Health Organization reports at least 650 pediatric hepatitis cases, including more than 200 cases in the U.S. 38 of those cases resulted in liver transplants, and at least 9 children have died worldwide. This new study from Israel links long COVID to hepatitis. Now, the researchers analyzed cases of just 5 patients here, ranging 3 months to 13 years old, each of them hospitalized last year due to liver problems. All 5 patients did test positive for COVID prior to their diagnosis of hepatitis. Well, joining Morning Rush here live in our studio to get some insight into this study is Dr. Jane Morgan, Executive Director of the COVID Task Force at Piedmont Healthcare. Thank you so much for being live in the flesh here, which is always
nice to be here,
no, exactly. So the thing that struck me first and foremost is that this is a very small study. We're talking about just a handful of individuals here. So how much should we rightfully kind of extrapolate from that?
And so it's something to think about. This is what we call case studies. So Israel Schneider Hospital looked at 5 children, and then they published that information such that other physicians and scientists can see. And we can say, hey, look at what's happening in Israel. Are we seeing this in our hospital as well? And so those were 5 very detailed cases. Since then, we've had 2 or 3 others who have also published their case reports. And so this starts to become a compilation of data of physicians exchanging information about, here's what I see. Are you seeing this in your hospitals as well?
And do we have a better grasp on exactly what the link is? Why does a COVID diagnosis potentially in kids lead to this risk of hepatitis? What's the connective tissue there?
And so there are a couple of theories on that. One is that COVID itself, as we move towards perhaps stimulating an autoimmune where the body maybe attacks itself, and you have this latent reaction later as we continue to learn more and more about long COVID, but also adenovirus. Adenoviruses are ubiquitous, meaning they're everywhere in our environment. Children and adults are often exposed to them. And we see that many children also are testing positive for the adenovirus. These generally do not cause severe disease. And so why would that be happening now? Is it a combination of the previous COVID infection and the adenovirus? Is something perhaps priming one virus to another? And so that's what we're starting to see. What Israel has published are case reports of 5 of their patients, and what they're doing is asking the world, what do you see in your hospital? Here's what we are seeing.
So if I'm a parent watching this at home and my kid is at risk for COVID or have COVID, what should I be on the lookout for hearing hepatitis in the headlines right now? What can I do, if anything?
Right, and so let's just start by saying this is rare. It's not very common, but obviously it's very serious. 90% of children who will have this will be hospitalized. We have several children who've had liver transplants and others who've gone on to die. And so what do you want to look for? Children can become lethargic, nausea, vomiting. Certainly if you see a discoloration of your eyes, that yellowing color of the eyes or the skin, you absolutely want to seek medical attention right away. Fever. So all of these are the types of symptoms that you notice in your children. When you notice something is just not quite right, they're slowing down, not as much energy, lethargic, fever, this nausea, vomiting, sometimes stomach pain, and then, of course, this yellowing color.
Gotcha. Last thing before we let you go, and on a positive note, it looks like vaccines for kids under 5 coming soon. It's going down that same pike that other vaccine groups have, so which is good news. I have a 2-year-old at home, and I've been waiting for this day a long time, but I also feel like a lot of other people do. Like, I'm glad it's coming. I'll get it, but I don't want my kid to go first. Let me wait a minute and see. I don't want to be part of the first wave. But wait, so what is your advice for parents who are waiting for that shot, and even though it's like a 1/10 of the size of an adult shot, but what's your advice to parents who are going to wait in line in droves to finally get the 4 and under set? Get that shot in their arm.
And you're giving such a great perspective as a parent. I don't want my kid to be first.
Right.
I want them to get it, but I don't want them to be first. But just think about this. You're not first. Millions of people have gotten this vaccine, and this is not a vaccine that was developed specifically for pediatrics. So these vaccines have been tested on many adults, and then we have bridging down trials to the children. So we're really extrapolating and applying that previous data So the children are not going first, as may be a concern if we're actually developing something very specific for a pediatric population. That is not this case.
And it is a milestone of sorts, because now every person in America, no matter their age, once this goes through all the steps of the approval process, everyone now can finally, 2 years plus into this, get the vaccine that's proven so effective.
Absolutely, and we're looking forward to that day. We certainly still need more and more people to be vaccinated. We have over 70% of our population, 80% really, that has received that primary series, but not so much success with that booster. Only about 30% of people have received that first booster, and so we still want to continue to make certain that we can have a healthy population as we move forward to variants that are yet unknown. And that may include being less aggressive than now. It doesn't mean that they will be worse, but we really don't know which way it will evolve.
I'm waiting to be eligible for my second booster. We'll talk about that during the commercial break. Shoot me up. Doctor, thank you so much for being here.
You're welcome. Thank you.
Excuse my coffee breath, but thank you for being here
I appreciate it.
early in the morning.